5 years ago, the world was hit by an unprecedented crisis, the COVID pandemic.
We urge leaders to take immediate action. This is not a drill.
Spain, India,
Russia,
United
South
States,
Africa.
Brazil has confirmed the first case.
As it swept across continents, care workers stood on the front lines, risking their lives to save others. We called them heroes, applauded from our balconies, and praised them in speeches. But when the applause faded, what became of the promises we made? During those dark days, we recognized how broken our health and care systems were. Governments vowed to fix them, promising better pay, safer staffing, prevention of violence and harassment, and support. Yet, as the crisis ebbed, so did the urgency for change.
No solo es el poco sueldo que recibimos, sino que además todos los días nos están diciendo, puede que mañana no tengas trabajo. No tenemos derecho ni siquiera de ir a comer. Es todos los días una presión psicológica.
Across the globe, the story is the same. In Brazil, home caregivers work tirelessly to provide dignity to others.
Sim, minhas profissões são todas cuidar de pessoas.
Eu gosto muito de ser cuidador. Cuidar já estava em meu sangue.
Eu gostei, criei amor por cuidar de idosos.
Yet, they continue to earn poverty wages.
As agências empregatícias, elas mordem certa parte do pagamento que as famílias passam.
In the Dominican Republic, home caregivers serve the most vulnerable, but remain unrecognized without benefits or job security.
No tenemos un beneficio social, no tenemos una capacitación. Muchas veces nos lleva a tener que dejar nuestro trabajo y a tener que dar una atención diferente.
Too many care workers experience violence and harassment while trying to provide care, particularly gender-based violence and harassment.
My colleagues, they are afraid of coming to work because they don't know if the patient will be aggressive or not.
Paciente tentou me molestar. Tive que relatar aos familiares e a princípio eles não acreditaram em mim. Não tinha ninguém para ter apoio, não tinha sindicato, né?
Despite their sacrifice, care workers have once again become invisible.
Bilang BHW, naranasan po namin ng mga kasama ko yung sumama ang loob. Bakit po? Hindi po kami nabibigyan ng pansin. Na kung tutuusin kami po yung nagtatrabaho sa ibaba, wala po silang report kung hindi po dahil sa amin, pero hindi po kami pinapahalagahan.
The cost of inaction is devastating not just for these workers, but for the millions who rely on them. Burned-out staff means declining quality of care, and an exhausted workforce threatens the entire system. But it doesn't have to be this way.
The way in which we stand up to powerful institutions is by organizing ourselves and sticking together. You have the legal protection to act as one, to be able to pull as many people together to sit down and collectively bargain on the conditions you need.
There are places where progress is being made, where care workers have secured union representation, fair wages, and safer staffing levels. These changes prove that when we invest in those who care for us, everyone benefits. It's time to turn our promises into action. We need formal employment for care workers, safe staffing, union representation, and freedom from violence and harassment. The heroism we saw during the pandemic wasn't a one-time event. It's the reality of care work every single day. To care for those who care for us is not an option. It's an imperative. Our communities are only as strong as those who hold them together.